Hi everyone, Dr. Jessica Schneider here from Empowered Health, and I am going to introduce a new test that we are starting to offer to our members as a benefit of membership. And so the test is called a multi-cancer early detection test, and this is a blood test that is able to detect up to 50 different types of cancer as early as stage 1. So this is a newer test on the market. It actually became commercially available in 2021. And the reason that I looked at this test and decided to start offering it here at Empowered Health is because it's something that I want access to for myself and my family. What's different about this test compared to other things that are on the market is that, first of all, it's not a hereditary cancer test. So this is not looking at genetic risk, such as testing for BRCA1 or BRCA2 mutations, for example, in breast cancer. What this test is doing is it's actually, it's more like a screening test. So similar to having a mammogram done or a colonoscopy for colon cancer screening, this is a blood test that is screening for these 50 different types of cancer to see if there's evidence of them presently in your body. And so the way that this test is run is you have a small amount of blood drawn and it's sent off to the testing facility, and they are looking for cellular-free DNA, which comes from different forms of cells when they're destroyed. And regular cells look different than cancer cells when you examine the cellular-free DNA. And so this test is able to detect that. It's a very specific test, meaning that it has low false positives. So actually the false positive rate for this test is documented at 0.5% presently in published studies. And so again, what that means is that if you get a positive back on this test, it's very unlikely that it's a false positive. And that's really important, as you can imagine, when you're testing for something like this, to not accidentally be told that you have a positive test for cancer when in fact it's not real. So this is a high quality test because of that low rate of false positives. The other thing that is nice about this test is that it can be done annually, and because it's just a small amount of blood, you're not going in for other testing such as an MRI or CT scan that's exposing your body to radiation or contrast dyes. So low risk of having the test done, low false positives, and ability to detect cancers that many of which don't have screening capabilities right now, such as gastric cancer, melanoma, biliary cancer, pancreatic cancer. So this test is currently not covered by insurance. It's actually, they're working on it, but like all things in our medical system, it takes years to run it up the pipeline. Right now, it is $949, and so that is paid directly to the testing company, and it's something, again, as a member benefit here that we're offering to our patients access to. So if you're interested in learning more about this, go ahead and check out the email that we have on it, and definitely talk with your provider here at Empowered Health.